NMC CBT questions and answers. Question number 326. Nurse delegates duty to a health assistant. What NMC standard she should keep in mind while doing this? Option A, she transfers the accountability to care assistant. Option B, RN is accountable for care assistant's actions. Option C, no need to assess the competency, as the care assistant is expert in her care area. Option D, healthcare assistant is accountable to only her senior. The correct answer is option B, RN is accountable for care assistant's actions. Question number 327. An inquiry was launched involving death of one of your patients. The police visited your unit to investigate. When interviewed, which of the following framework will best help assist the investigation? Option A, Data Protection Act 2005. Option B, Storage of Records Policy. Option C, Consent Policy. Option D, Confidentiality Guidelines. The correct answer is option A, Data Protection Act 2005. Question number 328. During the day, Mrs. X was sat on a chair and has a table put in front of her to stop her getting up and walking about. What type of abuse is this? Option A, physical abuse. Option B, psychological abuse. Option C, emotional abuse. Option D, discriminatory abuse. The correct answer is option A, physical abuse. Question number 329. You can delegate medication administration to a student if: Option A, the student was assessed as competent. Option B, only under close, direct supervision. Option C, the patient has only oral medication. The correct answer is option B, only under close, direct supervision. Question number 330. When doing your drug round at midday, you have noticed one of your patient coughing more frequently whilst being assisted by a nursing student at mealtime. What is your initial action at this situation? Option A, tell the student to feed the patient slowly to help stop coughing. Option B, ask the student to completely stop feeding. Option C, ask student to allow patient some sips of water to stop coughing. Option D, ask student to stop feeding and assess patient swallowing. The correct answer is option D, ask student to stop feeding and assess patient swallowing. Question number 331. Which strategy could the nurse use to avoid disparity in healthcare delivery? Option A, recognize the cultural issue related to patient care. Option B, request more health plan options. Option C, care for more patients even if quality suffers. Option D, campaign for fixed nurse-patient ratios. The correct answer is option A, recognize the cultural issue related to patient care. Question number 332. Nurse documented on the wrong chart. What should the nurse do? Option A, immediately inform the nurse in charge and tell her to cross it all off. Option B, throw away the page. Option C, write line above the writing, put your name, job title, date, and time. Option D, ignore the incident. The correct answer is option C, write line above the writing, put your name, job title, date, and time. Question number 333. A very young nurse has been promoted to nurse manager of an inpatient surgical unit. The nurse is concerned that older nurses may not respect the manager's authority because of the age difference. How can this nurse manager best exercise authority? Option A, maintain in an autocratic approach to influence results. Option B, understand complex healthcare environments. Option C, use critical thinking to solve problems on the unit. Option D, give assignments clearly, taking staff expertise into consideration. The correct answer is option D, give assignments clearly, taking staff expertise into consideration. Question number 334. What are the key competencies and features for effective collaboration? Option A: effective communication skills, mutual respect, constructive feedback, and conflict management. Option B: high level of trust and honesty, giving and receiving feedback, and decision making. Option C: mutual respect and open communication, critical feedback, cooperation, and willingness to share ideas and decisions. Option D: effective communication, cooperation, and decreased competition for scarce resources. The correct answer is option C: mutual respect and open communication, critical feedback, cooperation, and willingness to share ideas and decisions. Question number 335. What is the most important issue confronting nurse managers using situational leadership? Option A: leaders can choose one of the 4 leadership styles when faced with a new situation. Option B: personality traits and leaders' power base influence the leader's choice of style. Option C: value is placed on the accomplished of tasks and on interpersonal relationships between leader and group members and among group members. Option D: leadership style differs for a group whose members are at different levels of maturity. The correct answer is option C: value is placed on the accomplished of tasks and on interpersonal relationships between leader and group members and among group members. Question number 336. A patient has sexual interest in you. What would you do? Option A: just avoid it, because the problem can be the manifestation of the underlying disorder, and it will be resolved by its own as he recovers. Option B: never attend that patient. Option C: try to re-establish the therapeutic communication and relationship with patient and inform the manager for support. Option D: inform police. The correct answer is option C: try to re-establish the therapeutic communication and relationship with patient and inform the manager for support. Question number 337. An RN from the Women's Health Clinic is temporarily reassigned to a medical surgical unit. Which of these client assignments would be most appropriate for this nurse? Option A: a newly diagnosed client with type 2 diabetes mellitus who is learning foot care. Option B: a client from a motor vehicle accident with an external fixation device on the leg. Option C: a client admitted for a barium swallow after a transient ischemic attack. Option D: a newly admitted client with a diagnosis of pancreatic cancer. The correct answer is option B: a client from a motor vehicle accident with an external fixation device on the leg. Question number 338. A young woman who has tested positive for HIV tells her nurse that she has had many sexual partners. She has been on an oral contraceptive and frequently had not requested that her partners use condoms. She denies IV drug use. She tells her nurse that she believes that she will die soon. What would be the best response for the nurse to make? Option A: where there is life there is hope. Option B: would you like to talk to the nurse who works with HIV positive patients? Option C: you are a long way from dying. Option D: not everyone who is HIV positive will develop AIDS and die. The correct answer is option B: would you like to talk to the nurse who works with HIV positive patients? Question number 339. The code contains the professional standards that registered nurses and midwives must uphold. UK nurses and midwives must act in line with the code, whether they are providing direct care to individuals, groups or communities, or bringing their professional knowledge to bear on nursing and midwifery practice in other roles, such as leadership, education or research. What 4 key areas does the code cover? Option A: prioritize people, practice effectively, preserve safety, promote professionalism and trust. Option B: prioritize people, practice safely, preserve dignity, promote professionalism and trust. Option C. Prioritize care, practice effectively, preserve security, promote professionalism and trust. Option D. Prioritize care, practice safely, preserve security, promote kindness and trust. The correct answer is option A. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. Question number 340. When developing a program offering for patients who are newly diagnosed with diabetes, a nurse case manager demonstrates an understanding of learning styles by option A. Administering a pre- and post-test assessment. Option B. Allowing patients time to voice their opinions. Option C. Providing a snack with a low glycemic index. Option D. Utilizing a variety of educational materials. The correct answer is option D. Utilizing a variety of educational materials. Question number 341. Today many individuals are seeking answers for acute and chronic health problems through non-traditional approaches to healthcare. What are two popular choices being selected by health consumers? Option A. Mind awareness techniques and meditation practice. Option B. Stress management and biofeedback programs. Option C. Support groups and alternative medicine. Option D. Telehealth and the Internet. The correct answer is option C. Support groups and alternative medicine. Question number 342. You walk onto one of the bay on your ward and noticed a colleague wrongly using a hoist in transferring their patient. As a nurse you will. Option A. Let them continue with their work as you are not in charge of that bay. Option B. Report the event to the unit manager. Option C. Call the manual handling specialist nurse for training. Option D. Inform the relatives of the mistake. The correct answer is option B. Report the event to the unit manager. Question number 343. A nurse is having trouble with doing care plans. Her team members are already noticing this problem and are worried of the consequences this may bring to the quality of nursing care delivered. The problem is already brought to the attention of the nurse. The nurse should: option A. Accept her weakness and take this challenge as an opportunity to improve her skills by requesting lectures from her manager. Option B. Ignore the criticism as this is a case of a team issue. Option C. Continue delivering care as this will not affect the quality of care you are rendering your patient. The correct answer is option A. Accept her weakness and take this challenge as an opportunity to improve her skills by requesting lectures from her manager. Question number 344. A registered nurse identifies a care assistant not washing hands before caring an immunocompromised client. Your response: option A. Let her do the procedure. Correct her later. Option B. Inform to ward in charge. Option C. Interrupt the procedure. Correct her politely. Teach her 6 steps of hand washing and make sure she became competent. The correct answer is option C. Interrupt the procedure. Correct her politely. Teach her 6 steps of hand washing and make sure she became competent. Question number 345. A young woman has suffered fractured pelvis in an accident. She has been hospitalized for 3 days. When she tells her primary nurse that she has something to tell her but she does not want the nurse to tell anyone, she says that she had tried to donate blood and tested positive for HIV. What is best action of the nurse to take? Option A. Document this information on the patient's chart. Option B. Tell the patient's physician. Option C. Inform the healthcare team who will come in contact with the patient. Option D. Encourage the patient to disclose this information to her physician. The correct answer is option D. Encourage the patient to disclose this information to her physician. Question number 346. A mentally competent client with end-stage liver disease continues to consume alcohol after being informed of the consequences of this action. What action best illustrates the nurse's role as a client advocate? Option A, asking the spouse to take all the alcohol out of the house. Option B, accepting the patient's choice and not intervening. Option C, reminding the client that the action may be an end-of-life decision. Option D, refusing to care for the client because of the client's non-compliance. The correct answer is option B, accepting the patient's choice and not intervening. Question number 347. A patient with learning disability is accompanied by a voluntary independent mental capacity advocate. What is his role? Option A, express patient's needs and wishes. Acts as a patient's representative in expressing their concerns as if they were his own. Option B, just to accompany the patient. Option C, to take decisions on patient's behalf and provide their own judgments as this benefit the client. Option D, is an expert and represents clients' concerns, wishes and views as they cannot express by themselves. The correct answer is option D, is an expert and represents clients' concerns, wishes and views as they cannot express by themselves. Question number 348. What do you expect to assess in a grade 3 pressure ulcer? Option A, blistered wound on the skin. Option B, open wound showing tissue. Option C, open wound exposing muscles. Option D, open wound exposing bones. The correct answer is option B, open wound showing tissue. Question number 349. Joshua, son of Braid, went to the station to see the nurse as she was complaining of severe pain on her pressure ulcer. What will be your initial action? Option A, check analgesia on the chart. Option B, tell you will come as soon as you can. Option C, find the nurse in charge. Option D, go immediately to see the patient. The correct answer is option D, go immediately to see the patient. Question number 350. The nurse cares for a patient with a wound in the late regeneration phase of tissue repair. The wound may be protected by applying A. Option A, transparent film. Option B, hydrogel dressing. Option C, collagenases dressing. Option D, wet-dry dressing. The correct answer is option B, hydrogel dressing.